taking impressions for clear aligners, such as Smile Shapers, Invisalign, or Clear Correct. So a lot of times for these impressions, one of the best materials you can use is a two-step process with a putty material and also a light body correct flow material from FlexiTime. These two materials themselves get the most accurate impressions for clear aligners. It's actually recommended by a lot of these companies. And part of it is the putty itself is a very rigid material, so you're getting a very stable impression, but also you can manipulate the material as well. So if you have issues trying to capture those posterior region, a lot of times you have to make a little trough in the tray, and I will show you how to do that so you can capture those last molars. That's typically the most common error when we see taking aligner impressions. And then also using the correct flow to make sure that you get all the detail in that impression as well. So with a putty, you always have a base and a catalyst, and you're never gonna wanna cross-contaminate these two spoons. If you do that, it could distort the properties of the material. And you wanna make sure that you use latex-free gloves. That's also very important. That latex will also distort the impression as well. So when you're going to get ready to mix the putty, you're gonna use a 1-to-1 ratio. So we'll take 1 scoop of the base and 1 scoop of the catalyst. And we're gonna mix these two together. And while you're kneading the material, you're gonna wanna make sure that you don't see any stripes in the material and it's completely joined together. If you see stripes, that means it's not going to activate properly. So we are gonna make sure we see all purple. After it's properly mixed, you're gonna take the material and roll it into a hot dog. And we'll take our tray. Place that inside the tray. You do not need to use a tray adhesive with this, especially with the perforated trays as well, because the material is, like I said, a very rigid material. Once you have the material inside the tray, like I was saying, a great technique is to always make a little trough in the back. So you're just gonna lift the material up towards the back. So that way we are confident that we're gonna capture those last molars. Now there's a couple ways to take these impressions, but I like to then take my light body correct flow material and actually syringe that inside of the putty, right on top. And this is gonna help capture all the detail for the teeth. And the good part is with FlexiTime, you get, again, 2 minutes and 30 seconds of working time and 2 minutes and 30 seconds of set time. You don't need the full 2 minutes and 30 seconds outside the mouth. After a minute, you can place it in, but if you do need, especially for full arches, you have that time. So your compression can take you 5 minutes, or it could take you 4 minutes, 3 minutes and 30 seconds. Just depends on how much time you need outside the patient's mouth. After I have my tray loaded, that's when I'm gonna seat this impression inside the patient's mouth. And I wanna be very confident that you guys know to make sure that you apply pressure when you're seating this, to make sure that your fingers, your thumbs, are placing that directly on top of the patient's teeth, okay? I don't wanna use this handle. When you utilize the handle, it's gonna cause the material to shift. So it's always better to take the impression and actually hold it down with your thumbs.